Spokane County taxpayers are paying the bill for alleged killers, rapists, and child molesters to see doctors, dentists, and specialists.
This year, the county will spend more than $2 million paying for medical services for jail inmates. KXLY4's Erik Loney looked at the high price of jail care, and he's live with us tonight. Erik.
Yeah, jail inmates and prison inmates in both Washington and Idaho are entitled to basic medical care while they're incarcerated, and many times it's the only medical care they get because they don't or won't get medical care outside of jail. Spokane County prosecutors want Chris Devlin put to death. Police say he murdered a man the night before he was scheduled to testify against Devlin in a burglary case. He's been in jail almost a year waiting for his first-degree murder trial. And while locked up, he's taken advantage of the jail's dental program by having 4 abscessed teeth pulled.
Best dentist I've ever been to. I've been to a lot of dentists, so he's a super good guy.
Alleged killers like Devlin, rapists, burglars, and all other jail inmates get taxpayer-supported basic health care while behind bars. State law requires it.
You can't let what they were arrested for interfere with that.
Lieutenant Dan Volosky manages the jail's medical unit.
They're still humans. You have to treat them like humans. And if they have a problem, you need to address it.
The medical budget for the jail this year is $2.1 million. The jail employs 11 nurses and pays a dentist and doctor to see inmates in the jail's medical unit. Dentist Jim Borikis comes twice a week and performs extractions and temporary fillings on inmates suffering from toothaches.
They're not getting top drawer treatment. You know, they get very basic pain relief.
A doctor visits the jail Monday through Friday to treat inmates who are sick or injured. Inmates who can't be treated in the jail are transported by armed jail officers to the hospital or local doctor's offices. Inmates are taken to specialists like oral surgeons, oncologists, and cardiologists.
One guy I knew, after he had a small heart attack, and he ended up getting a triple bypass.
From the jail?
And from the jail. He was kind of happy about that.
Last year, the county paid $59,000 for an inmate's heart surgery, $39,000 to repair a lacerated spleen, and $34,000 for an inmate's abdominal surgery. In total, the county paid $644,000 treating inmates outside the jail.
We're starting to see more and more expensive procedures.
Lieutenant Volosky says he tries to get inmates released from the jail when they need an expensive procedure, so taxpayers don't have to foot the bill. But if the inmate is too dangerous, the county will pay.
Now, if it comes down to it where the person needs something done immediately, we'll go ahead and pay the cost of it and have it taken care of.
Now, why do that?
It's the right thing to do. They have that right.
But Volosky admits sometimes getting inmates released just doesn't work.
Gotten someone furloughed, set it up for them to go directly to the cardiologist or hospital for the care and treatment. They never make it because they can't afford it. They wait until they're rearrested, they come back to jail, and we still have to deal with the same issue. So then again, it's like, do we take a second chance, or do we just go ahead and bite the bullet, pay the $50,000 or $70,000 to do it?
The county enrolls inmates in a medical plan to reduce costs. Inmates like Devlin pay a $12 copay every time they see the dentist or doctor. One of the most expensive costs in the jail is medications. Last year, the county spent $475,000 on prescription drugs for inmates. Devlin told us getting medications is one of the most contentious issues behind bars.
Like I have a prescription for ibuprofen, 800 milligrams. He won't give it to me.
Jail doctor Dr. Criswell Kennedy decides who gets medications and who does not. He refused to be interviewed and have his picture taken for this story. Kennedy's decision to deny convicted killer Shelley Stark some of her medications during her trial is the basis of her appeal. In jail mail, Stark begged Kennedy for a prescription of Xanax. She wrote she was having panic attacks, nightmares, and claimed she was suffering. Kennedy denied a request, responding, "Let's try to keep you off addictive meds at this critical time."
I never wanted to kill him. I never, ever wanted to kill him.
Stark testified in her own defense. Her new attorney is arguing Stark wasn't herself without her medications.
She looked like a raving lunatic. I mean, seriously. That's what I saw. She was all over the board.
The jail does not allow inmates to bring their own medications because officers can't confirm the pills are real and not contraband. When inmates ask for drugs or claim they have a legitimate prescription, Lieutenant Volosky says they try to confirm it with the inmate's doctor.
Problem is, in a lot of cases, the provider will fax back to us saying, I haven't seen this guy in 4 or 5 years, or else they'll fax back and say, yeah, but he's a drug seeker.
Aside from the drug issue, Devlin says the health care in the county jail is good. So good, Some people break the law to get it.
But yes, there's a lot of people coming to get stuff fixed they wouldn't have had fixed on the outside. So.
The state of Washington, of course, is dealing with the exact same issue. In fact, last week, Governor Gregoire signed a bill that will release low-risk inmates with medical problems so they can pay for their own medical care. Reporting live, Erik Loney, KXLY4 HD News.